Okay, and let's go here. Okay, we'll go ahead and get started. So my name is Katie Lindstrom. I'm the director at the Pacific County Health Department. I also have on the Zoom today with me Lori Ashley, and she is our lead COVID nurse. And she will also be able to answer questions. She's our lead contact tracer and has been doing a lot of the work with the families and staff who have been notified so far that they've been close contacts. So we'll go ahead and just get started. I kind of wanted to walk you guys through just a couple procedural things on how these kind of situations are handled first, and give you some definitions on who is a close contact and who is not a close contact, and then how long different
Katie, you're muted.
All right, I'm going to start all the way over.
Sorry.
That's okay. I'm sorry about that. So my name is Katie Lindstrom. I'm the director at the Pacific County Health Department. Also on the Zoom is Lori Ashley. She is our lead COVID nurse and our lead contact tracer for the county. So probably has been speaking to any of you who are considered close contacts, or if you have children in the district who are. She'll also be able to jump in and kind of answer some questions as we go. So the first few slides, I just want to give you guys an overview of what happens and what's the process when there's a positive case in the school, just so you understand all the different actions that are being taken, and also to help you understand who is a close contact, who is not a close contact, and then what that means in terms of being excluded from school and for how long. So first off, I just want to go through when there's a positive case in the school, the first step is that public health is notified. We immediately contact the case who is positive, and we instruct them to isolate for 10 days. And it's going to be at least 10 days. If they continue to have symptoms after 10 days, then their isolation period will be whatever point they stop having symptoms plus 24 hours. So 10 days, or when symptoms resolve without medication, whichever is longer. We also immediately begin the case investigation. This is where we start working with the school district very intently to get a list of potential contacts that student or staff may have had during their infectious period, which is going to be defined as 2 days prior to when they first exhibited symptoms. That potential contacts list is going to include a whole bunch of people, definitely classmates, other students who rode the bus with the student, potentially lunchroom or playground contacts. It's really important to note, though, that just because you're a potential contact, it does not mean that you're a close contact. The close contact is going to be determined based on the interview with the public health nurse, and it's going to be based on a lot of different factors, which we'll go over. So again, the potential contacts are interviewed by public health. Once we complete those interviews, we determine who is actually a close contacts. And then those people who are determined to be close contacts are instructed to quarantine for 14 days. And they have to remain on quarantine for 14 days, regardless of if they have symptoms or don't have symptoms, or if they get a positive or negative test result. They have to be on quarantine for 14 days. And then any decisions to close classrooms or entire school buildings are going to be made kind of on a case-by-case basis in consultation with the district, and it really depends on individual circumstances. In this case, we did quarantine 2 classrooms, and so those 2 classrooms were quarantined, I guess, and closed down for 14 days. In addition, it sounds like the district, maybe in consultation with ECAP, decided to go ahead and close down all of the preschool classrooms, even the 3 that were not affected. And I believe that was because of lack of staff to effectively run those classrooms. All right. So what is a close contact? I'm sorry, what is a potential contact? So the potential contact is the big net that we're going to cast to get anyone who potentially could have been a close contact. This is going to be on the bus, drivers and students who rode the bus with that student, in the classroom, any students and teachers, lunchroom contacts, playground contacts, and then anyone else just in their outside of school life who may have spent more than 15 minutes with the student at a distance closer than 6 feet. So in that 15 minutes is cumulative over the course of a day. It's really important, again, to remember, because just because you're a potential contact, it does not necessarily mean you're a close contact. So how do we determine who is a close contact? It's going to be off the top, anyone who meets that closer than 6 feet, more than 15 minutes with the positive case. That's going to be a close contact regardless of anything else. Due to the duration of time spent, especially in an elementary classroom where the students don't move around, they spend a good 6 hours, 7 hours maybe a day together. Because of the duration, even if they're wearing masks and even if they are distancing, our health officer has instructed us to consider that entire class a close contact. Now, if they are distancing and wearing masks, the risk is going to be very small, but because you are a congregate setting with a high risk of exposing a lot of people, he's being extra cautious in considering that entire classroom close contacts and excluding those students and staff for 14 days. So again, this is going to typically apply in elementary classrooms. It's not necessarily going to apply in middle or high school, though, where students are moving around and not necessarily spending 6 hours a day together.
So you're aware, Katie, we are grouping our middle school like an elementary, so only our high school is not affected by this policy.
Okay. Yeah. And there's good and bad by the policy. The good thing is that you're limiting the total number of people who could be exposed. If you're keeping kids cohorted, then it's just that group of 10 kids that are cohorted together that would be, potentially exposed. Obviously, the bad thing is they automatically become close contacts. But I think it's probably a good trade-off versus exposing a lot more people in the school potentially. And then the last group that would be a close contact on a case-by-case basis would be those bus, lunchroom, and playground contacts. You're only going to be considered a close contact if you actually had close contact in one of these settings. So here, as an example, if the student who is positive rides the bus and they sit in the front of the bus and it takes 25 minutes for them to get home, any students that were sitting within 6 feet of that student on the bus is going to be a close contact. But let's say you have some students who are in the very back of the bus, they would not be close contacts because they weren't within 6 feet. Or if the student, let's say their bus ride was only 5 minutes long, then you're not meeting that duration of time standard. So nobody on the bus would be considered a close contact. So those are kind of individually decided based on individual circumstance. All right. So moving on. So once you're a close contact, you will get a call from a public health nurse, and that's typically going to be Lori, who's on the phone with us. She handles the majority of the cases. We do have some overflow contact tracers, but Lori's typically the person who would be calling you. If you do not receive a call, that's because you were not determined to be a close contact. It's very important that if you do get a call from public health that you answer it. She's going to be able to kind of talk through the situation with you, explain quarantine, and also advise on testing options. So these are the details of the current cases at Ocean Beach School District. And we want this out there just so there's accurate information and everybody has information that's true. We know how stuff can spread sometimes. So there's 2 cases. One of those cases is confirmed, meaning that it's been confirmed by a PCR test, which is the more accurate confirmatory test that we use. That student was in the preschool. That student is in isolation, again, for a minimum of 10 days or 24 hours after symptoms improve, whichever is longer. The last date of potential exposure was Monday, the 19th. All of the classmates of that student are on quarantine for 14 days. So that means through the end of November 2nd, meaning they can return to school on November 3rd. And again, the decision to close the other 3 preschool classes for 14 days was due to lack of staffing. Students in those other 3 classes are not on quarantine in the rest of their life. They're just, the decision was made to close school down. The other case is a probable case. This case has not had a PCR confirmation test yet. They have not tested positive on a PCR test. However, they are a close contact of a confirmed case. And because of that, we're considering them a probable case. So this is the second grade classroom. This individual is also in isolation. We expect to get the results back on that PCR, I think pretty soon, within the next day or 2. Again, the last date of potential exposure was the 19th. And again, we're waiting on that confirmatory PCR. The classmates of that student are currently on a 14-day quarantine. If the PCR comes back negative, we would reevaluate the need to quarantine that second grade classroom. I'm going to let Lori jump in just because she's our testing guru. Lori, did I miss anything pertinent this section?
No, that is very accurate. Typically, we use rapid testing, the antigen testing. That's what we hear a lot of people coming up to Willapa Harbor Hospital to get, because they can get results literally within an hour or 2. And so we see people doing that. That test is a good test. It's probably close to 90% accurate, but the true confirmatory test is the PCR, and that test typically takes 3 to 5 days. Now, Willapa Harbor Hospital is going to stand up at the end of this week what they are calling a rapid PCR, meaning you will get results like same day within 8 hours. There is also one of those machines at Columbia Memorial Hospital, but it is only used in very specific cases. And Columbia Memorial Hospital, I think that's coming yet, right, Katie? They will only test people that are symptomatic and are referred, basically. So
actually, Lori, I think we just got confirmation that they're only testing people who need to be screened for a surgery that's happening at CMH. So I don't think CMH is going to be a good testing resource.
That's
for anybody.
Exactly. They're not, that isn't a great resource for us at this time.
Yeah.
So,
and we will go over some other testing resources here at the end.
Perfect.
Awesome. And that does, just so people understand, the reason that that second grade classroom was quarantined without having that confirmatory PCR was because it does take a few days, and we don't want to leave that class in session and then have that come back positive. And meanwhile, the last 3 days, we've exposed a classroom of kids. Our hope is it comes back negative, and then, we can look at reversing that quarantine. But we'd rather err on the side of caution and exclude, assuming it's going to come back, than not exclude and then have it come back positive. So really, it was done out of an abundance of caution on that case. All right. So what about other students and staff who were in the building? So students and staff who were not in the classroom with the positive cases and who have not been identified as a close contact do not need to quarantine. The risk is very low. It's about the same as if you work anywhere else. So that's a really important thing to note. There is no need to quarantine unless you're symptomatic. There's no need to go get tested. So again, however, if students or staff who aren't close contacts have symptoms, we do encourage you to self-quarantine and get tested. And we would encourage anybody with symptoms to self-quarantine and get tested. That's general advice we apply to everybody. If you do not receive a call from a public health nurse, that means you have not been identified as a close contact. Now, here's the testing options. And actually, I did not update this. We got this information about 20 minutes ago. So today we held a testing event. We had about 62 people come through. Those test results will be, Lori, end of week. Does that sound right?
Yeah, they're being driven to Seattle right now in hopes of having those Friday, but usually if not Friday, it'll be Saturday. And I will call, negative or positive. I will call people.
Okay. We also, through the end of this month, are offering drive-through testing twice a week in Long Beach. So if you were unable to get tested today and you have symptoms or you were a close contact, please call us at 642-9407 and we will get you scheduled for an appointment for a drive-through test in Long Beach on Friday. Ignore what it says there about Columbia Memorial Hospital because I don't believe that's actually true. However, Willapa Harbor Hospital does do no appointment necessary drive-through testing Monday through Thursday from 12 to 2. So this is a great resource. This is a rapid test, so you're going to find out same day. If you do test positive, you would still have to do a confirmatory PCR test, but this is a good resource. And then, of course, you can also call your primary care provider and see if they're willing to give you a test. Now, it's important to note you need to quarantine if you do get tested, whether you're a contact or not. You have to quarantine from the time you're tested until you receive your results. So don't get tested and then go out to a restaurant and go to your friend's house. If you're sick enough to get tested, then you need to stay quarantined until you get those results. And then also, if you are a close contact, you have to stay in quarantine 14 days regardless. So even if you go get tested and it's negative, you have to stay in quarantine for 14 days. And that's because the incubation period for COVID is about 14 days. If you get tested today, you could be negative, but in 4 days from now, you could be positive. So we need to wait that whole incubation period of 14 days with close contacts. All right, so this is the next question. I know we're speaking with staff, but we're doing the same presentation with parents tonight, and I think this is still relevant. Will my child be excluded from school? If yes, when can they return? So first of all, close contacts are automatically excluded for 14 days, regardless of any test results. The COVID positive student is going to be excluded for 10 days or 24 hours after symptoms improve without medication, whichever is longer. And this is a big important one. Students and staff with no known exposure, so that are not close contacts, and who do not have any symptoms are not excluded from school. And then this part gets a little confusing. There's basically two sets of symptoms, Class A symptoms and Class B symptoms. Class A symptoms are the more commonly known symptoms to go with COVID. Class B symptoms go with COVID sometimes, but not as commonly as Class A. So basically, students and staff with Class A symptoms, any Class A symptom, or one or more Class B symptom that lasts more than 24 hours, and who have had no known COVID exposure, need to be excluded from school for 10 days, or they can return sooner if they have a negative test or a doctor's note. And I don't know if Michelle's on this email, but we'd been emailing about this earlier today. This is straight from Dr. Kreger about 10 minutes ago. So this is the most accurate, up-to-date information. And I'll get this out to you guys in an email, Amy and Michelle. And then students and staff with only one Class B symptom that lasts less than 24 hours and who have had no known exposure to COVID can return once symptoms resolve. All right. I do want to just quickly kind of go over a couple things regarding risk. Schools actually have been determined when students are wearing masks and the safety protocols are being followed, it has been determined to be a low risk setting. So we don't want people to be overly concerned. I mean, a natural amount of concern if you've potentially been exposed is good and healthy. But we do want to make sure people know that if the school is doing all of the safety requirements, the risk is actually pretty low, but it also reiterates the importance of those daily symptom screenings, masks being worn at all times, distancing, hand washing, and increased sanitation. And again, you guys have seen this probably, but just to kind of show again, like that mask wearing and distancing is very effective. It really reduces your risk of spreading COVID versus no mask wearing closer than 6 feet. So you can kind of see that how that risk of spreading COVID goes down the more of those interventions that you're employing. Resources, so our health department page and also the state website, these are both really good resources. If you need more information, you can also call us anytime at the EOC. And we are, well, not anytime, Monday through Friday, 8 to 4. We're happy to answer questions or give you referrals for more information or just talk through a problem with you. So wanted to provide those resources as well. And with that, I am done with the presentation. So we can certainly take questions. And I can just probably read through the chat if that's the easiest, if people want to kind of put their questions in the chat, and I'll read through them and we can answer those. All right, so the first one, lunch is the most contact as it's unmasked for more than 14 minutes. Yes, Kelly, so that would be true. However, it's going to likely just be the students who, any students who were within 6 feet of that student for greater than 15 minutes. So not necessarily everyone in the classroom, but it would include, close contacts would include students who were sitting close to that student for the entire lunch period unmasked. Oh, and I see somebody else had clarified that if lunch is in the classroom, and I'm assuming, is that what you guys are doing, that they would already be considered a close contact, and that is correct. Are the kids who are quarantining being tested at all? Yes. Lori, do you happen to have do you know how many of the actual quarantine kids got tested today? I know we had 62 come through, but some of those were going to be students that just had symptoms, but weren't necessarily in the classroom. But do you have that information, Lori? Lori's still on with us? Let's see. I can't see. There's so many faces on here.
Sorry, Katie, on a call. I believe the number of actual students from the second and the preschool classrooms was probably pretty close to 20 some, if not more. But most of the really little people that came, their adult also got tested, if nothing else, just to be a role model. And so that's where we went.
Okay, so it sounds like a good majority of the close contacts have been tested. They all should be quarantining. They should not be at school. They shouldn't even be going out in public for 14 days. And then again, we do have that offer of additional testing on Friday for anyone who wasn't able to take us up on it today. And then there's, of course, Willapa Harbor Hospital on the other days as well. If a person is asymptomatic and they're a close contact, it's nice to know if they have COVID or not, but a little bit less necessary than if they actually have symptoms. Okay, the kid who is probable has been tested. All others were offered testing. Okay, Amy answered that question. Ocean Beach Hospital is offering drive-up testing for established patients only. Thank you, Amanda. So that's another good point. If you are an established patient at Ocean Beach Hospital, sounds like they're offering drive-up testing. Amanda, is that through their like their emergency room entrance kind of area?
Yes, but you'd have to call your primary care provider in order to get scheduled.
Okay. And I do want to note too that people who don't have insurance, the testing, if you're symptomatic or if you're a close contact and you've been directed to get a test, it should be free. There is a HRSA program that should pay for the tests. Also, if you have insurance, the insurance is required to cover it. So should be free for everybody. What about people who were close contacts to close contacts? How far do you contact out? Good question. We get asked this all the time. We only go one layer deep. So we are quarantining and working with close contacts of a positive case. Close contacts of close contacts don't have to quarantine. There's no special instruction in that situation. However, if you have a positive case, they have a close contact. Once one of those close contacts tests positive, then their close contacts would now have to quarantine. So it goes like that, but we basically go one layer deep. Otherwise it could be a rabbit hole like nothing else. It would continue forever if we did close contacts of close contacts. That is part of why we really do want those close contacts to get tested though, so that we know. And then that would trigger them letting their close contacts know. And that really is how we stop this from spreading. All right, and then I have a question. What are the overall county trends right now? So we have been in a high risk status for 2 weeks at this point. High risk is defined as greater than 75 cases per 100,000 population over 14 days. We're at, I believe, 87 cases per 100,000 currently. I can tell you the overall trends. We started out very slow. I think we were the second to last county to even get a case early on. We had a bump in the summer. It kind of came down a little bit in the fall. And then again, it's gone back up here in the last couple of weeks. So that's where we're currently at. We're hopeful that, that our numbers go down. If we do maintain this high risk status for another week or maybe a little bit more, we may be changing our recommendation regarding in-person schooling. That high risk status also dictates what kind of sporting events can happen and to what level. So at the high risk, sporting events, well, I'm sorry, not events, but sports are really limited to basically practices and drills only in socially distanced small groups of 6 or less. So it's really, really limited. If we get down into the moderate or once you get to the low risk range, you can actually start playing some games and different things for at least the low risk sports. So that's why that case rate per 100,000 is important. It really dictates our advice regarding both schools being open and then also sports. All right. Any other questions? That was the last of it in the chat box.
There was a question that was sent to me about the testing that was done today. So if it's because it was sort of offered to all of the people, if we had somebody that works for us that chose to get tested but doesn't have symptoms.
So the testing today was for people who were identified close contacts or anyone else who had symptoms. It wasn't meant for people without symptoms.
Okay.
The
so
only
if they,
people
if they
without
showed
symptoms,
up to test, they should be out of school.
no, the only people who need to be out of school are people who have symptoms, and then anyone who's a close contact.
Okay.
Those are the people who need to be out of school. If somebody showed up and they weren't a close contact and they didn't have symptoms, they probably shouldn't have gotten tested. But
and I don't know if they did or not. It just was a question that came up. So
yeah, it wouldn't exclude them. And just so you guys know, we did open today's testing event. Normally when we do these testing events in response to like a higher need for testing, we limit it to just the close contacts of the positive case. But because it sounds like you guys have had a lot of like sniffles and different colds and stuff going around the school, we wanted to open it up to anyone with symptoms just in case and to catch any other maybe stray cases that might be out there. So that wouldn't actually be typical with one of these pop-up events like we did today, but we did want to just catch everybody, with symptoms. We're setting it up, and I think doing a few more tests isn't that hard. A lot of the work is just in setting it up. So whether we do 30 tests or 60 tests, there's not a huge difference. So, all right, any other questions? Did I miss anything else in the chat? Amy, do you have anything to add at all from the districts?
We learned a lot, doing this first round. And I think most of our learning was about the preschool. But we definitely have learned a lot and feel better prepared to handle it as things happen in the future. And as always, we watch those county trends carefully, and I meet with you guys a couple times a week, and we'll just keep our eye on things and keep being as safe as we can.
All right. Thanks, Amy. And everybody just, continue to do the mask wearing, distancing. Those things really do work. That we do believe the risk is fairly low, at least in those classrooms where the masks are being worn. But again, we just really want to be extra cautious with the schools because we don't want to put people at risk, especially little ones and all the staff who are, charged with their care. So please, again, reach out if you have any questions, if you need more information. And I think that's probably it for today. So thanks, everybody.
Thank you, Katie, and thank you for all your help. And Lori, you were also a huge help through this. So thanks for all of the work of Pacific County Health Department.
Great. Thanks, you guys. Have a good day. Bye.
Katie, do you have a moment? This is
Sure.
Lori.
Let's jump on another link though, okay?
That's fine. Tell me what.
Okay, hold on. Let me,
Amanda, if you're on.
Lori, go ahead and let's get on the EOC all day link.
Okay.